Welcome to Beyond the Lab, a series by the Office of Career Development within the Biomedical Research, Education, and Training Department of the Vanderbilt University School of Medicine. My name is Kate Stewart, and I'm here today with Lori Rudolph-Owen. Thank you for coming back. You were part of the Department of Cell Biology while you were here.
Yep.
So thanks for coming back. We're glad to have you.
Thanks for inviting me.
Tell me about your time here at Vanderbilt.
I was in the Department of Cell Biology, as you said, with Dr. Lynn Matresian, who's no longer here, and studied the role of matrix metalloproteases in mammary gland development and uterine involution.
Okay. So what did you do after that?
So after that, I actually did a very short postdoc here with Graham Carpenter in biochemistry, and did that because my husband was also in the cell biology program. And he was finishing up his PhD degree, so basically stayed here to do a short postdoc. And then after that, we decided, okay, what do we do with two of us out there trying to get either postdocs or positions? And so basically just started applying for jobs and ended up in Boston at an up-and-coming biotech company called Millennium Pharmaceuticals, and used my skill sets in more pathology and histology to enter a molecular pathology lab there. And honestly, the reason I got hired is because I knew how to do in situ histochemistry. So that was literally the reason. And the company was growing and wanted someone to have that skill set. So did discovery biology for a number of years, and then ended up being the research person on a new program or new asset that we had licensed in that was going into phase 1. Okay. And so I was on a program team there, and then I went, wow, this is development. This is what clinical development is, and used that time within that team to really understand what all the other development aspects are, and worked with the team lead at the time and many of the others to really just go, what is this all about? So kind of got the development bug and also the program management bug. And so my next position was a program manager on the development side, and really diving into and learning about all the operational details it takes from phase 1 clinical studies all the way through until submissions and approvals. And then from there, moved from a program manager into a team leader. So running that team, which was a lot of fun. So within this time, moved a couple of companies, but in the Boston area, that's pretty easy to do. So being able to go from program manager to really learn all the operations to a team lead, which then I was really driving that strategy for the program, interfacing with the senior management as well as all the operation team, and driving a program. And in that sense, I actually was working on a phase 3 compound as well as marketed. So it was marketed in one indication, and we were looking at another one. And then from there, really just kept moving up into a larger team. So from there, went to actually lead a full program management department at a different company. But then had a few folks that had specific program teams. Did a stint in a large pharma for a couple of years, and learned a little bit about how to meander through that big behemoth, which was fun. And then in the last 4 years, I'm at a company called TESARO. And so there have entered when the company was about 35, 40 people. We're over 700. And so I run a department called Portfolio Management and Assessment. So I have several team leaders, program managers, portfolio reporting, and also competitive intelligence within my team.
Okay, so what exactly is that?
Yeah, exactly. I know.
What
does that mean? It's like all these words. So what we do is when a compound runs through development, right? You're testing it in humans, so clinical studies, phase 1, phase 2, phase 3, and then once you get all the data, you want to submit it. Well, within that time, you have a complete army of people who is working on this. You have the chemists who are manufacturing the drug. You have the regulatory folks that are dealing with agency. You have the non-clinical who are animal testing, and you have all the clinical folks who are running clinical trials around the entire world. Right. So you have that big bevy of people, big army, right? And so that army can't communicate with each other at all. So what you have then is you have a point person for each of those departments that sit on a team. And that's really how the communication flows and that strategy flows. And so the team leader actually runs that team. And so what folks on my team do, and what I did before, is you're kind of the, I guess, COO or CEO of that small team, that you're really driving that asset. So, I work in cancer, so a cancer molecule, through clinical studies, through the regulatory process, making sure there's enough drug there, dealing with internal senior management to make sure the strategy is within what the company wants to do, whether we want to start couple of phase 3 studies or go right from phase 2 into submission. So it's really working that interface between the strategy for the program and then the operations to make things get done. So you're managing that process. So that program, you're managing it, program management.
Right.
Right.
So
does that make sense?
It does.
Okay.
Much better. So I'm sure your daily activities are different every day. Like, what are some of the breakdowns of things, categories that you spend your day doing?
Yeah, so a lot of what I do right now is really information kind of connectivity or collaboration. So there's a lot that's going on, as you can imagine, right? So with me, I'm interfacing between all the program teams. So there's 5 or 6 specific molecules that we're running through this program, interfacing with the functional line head. So like the head of clinical operations, the head of regulatory, the head of pharmaceutical development, making sure they all know what's going on. And so my role is really that information communication piece to make sure that there's a fire over here, we all make sure it gets taken care of. Or if there's new data that comes out from a clinical study, that we'd have to adjust our strategy. So bringing together the decision makers and the program team and ensuring that that gets done.
Right.
So it's really about transparency. So on a day-to-day, I communicate with the decision makers of the company, so the president, CMO, CSO, communicate with the program teams, talk to some of the operational folks, so really make sure there's connectivity. We also put out reports so that people understand, portfolio reports, this is all what's going on, we're hitting our milestones, we've met our goals. And then also a big piece is really the mentoring and coaching. So I work quite a bit with the team leaders for them to understand how to communicate or what the issues are with maybe a person that's on their team that is difficult, or that they're not sharing information, or how we should tell the story in a presentation. So really working quite a bit with them on that mentoring coaching aspect.
Okay, so how is this a good fit for you just personally?
So it's interesting because I think the biggest thing throughout my career is trying to be introspective of what I'm good at. And I think that's one thing that we all need to do even more often. If I look back in retrospect, and even honestly when I was a grad student and a postdoc, I had all of these projects going on that I literally had like 10 things in the fire at once. And I really enjoy that. So I like a lot of things going at once. So I like that breadth. And being able to connect people, processes, strategies to operations, it's like a big puzzle piece. So for me, I have more breadth than depth. And being really realistic with myself of, as a scientist with a lab, you're going down into, minutia on receptor, what mutation is going on. That it's not where my skill set is, my sweet spot. So being really introspective to realize I really like putting the pieces of the puzzle together. And so this is perfect for me. And when I kind of learned that, I was like, oh, okay, I like this. It's a lot of fun.
Great. So if a student saw you today, postdoc met you today, and they're like, I really want to do what you do, what should I do now to be ready for that? What would you tell them?
So first, I would tell them, so you got to get into industry. So you can understand what it's like, right? Very different, because what scientists do is drug discovery, right? So definitely spend time usually in industry doing drug discovery, because that gives you an idea then of kind of at least one piece of the puzzle. Or even I've seen some folks get into a little bit like medical affairs or some other place within development, but then it gives them a good idea of kind of the environment. So in order to get into industry, there's lots of different ways to do that, but particularly if they're coming from the science side, that's the easiest way to get in, is get into discovery research. And then once they're in there, it's more of networking, asking people. I mean, there's project teams all the time. This is what industry does, right? So getting an idea of, hey, do they think they'll like that? I mean, what I do and the program managers and the team leaders, people say herding cats. That's actually what it is. It's really moving behind people and making sure it gets done, but they're not the ones that are necessarily doing the assay or doing the clinical study. So they're kind of behind coaching and pushing people along, and that's not for everyone. So what my advice would be is get in and then find out if you actually would like this. And talk to people who are doing it.
Okay, good. So you mentioned networking. How do you network? What are your strategies?
Yeah, so I've been in a number of different companies. Started at Millennium Pharmaceuticals, and I think I've been at 7 different companies. And so my strategy a lot is to identify and talk to people while I'm there, and the nature of what I do, I end up interfacing with a lot of folks. But I think where the hard part comes in is keeping that connectivity as I grow into different companies and different positions. So I work at it. LinkedIn is a great source, but it's also, you see that someone moved jobs and you connect with them. Hey, congratulations. Hey, we haven't connected in a while. Let's go get a cup of coffee. Or, I see you have a position open. I actually know someone who might be interested in that. So really, it's spending that time to keeping the dialogue going, which in some cases I do better than others, depending on what's kind of going on.
Sure. If you had to do Vanderbilt over again, what would you do differently?
I think I would, on the network side, I think I would really leverage all of the people that are here. So as a grad student, even postdoc, I didn't take advantage of all of the people who now will be all over the country. So keeping that connectivity to these folks, I think, is really important. There's been people I've seen at meetings. I'm like, oh, wow, where are you at? I haven't seen you in forever. And understanding where other folks have gone, I mean, that's a fabulous network to be able to have, and it's at your fingertips, and you don't even know it. So that's definitely something I would do. I would still, pick the lab, do the postdoc. I think it's great having that scientific background, critical thinking. All of it's extremely important for all of what I do. All the team leaders, they all have PhDs, right? Because what they have to do is look at data, analyze it, critically think about it, and ask a lot of questions. And so that's why they're all PhDs. And so really what I've done throughout my career and continue to do, I couldn't have done without the experience at Vanderbilt.
Awesome. Thank you so much for your time.
Thank you. Really enjoyed it.